Uh, a very good evening to one and all present over here. Myself, Dr. Sheena. So today we'll be actually discussing a very important topic, that is the composite resins and amalgam. Hope you I'm audible to you all and you can see my PPT, right? Uh, Okay, thank you, Kavya. So, I hope like you had a thorough reading on the synopsis of the discussion which we had on the last class. That is the physical properties of dental materials, the gypsum products and impression compounds. And some of the people actually messaged me personally some of their doubts. Yeah, I'll be clarifying that. No problem in that. So please do continue reading because dental materials is a very important topic for your NEET MDS, because lot of image-based question as well as twisting questions is being asked from these areas. And yet another important topic is composites. Okay, there is a lot of things that you need to know on composite, but not in a wide scale, but in a NEET MDS point of view, right? So let us start with the class. So what is a composite? Composite is actually, we know it is a combination of two or more material that is having a chemically distinct interface between them. So you all know what is composite, right? So we have to know the composition of composites. That is very important, and I will show lot of questions have been asked from these regions. First of all, talking about resin matrix. So you know, it consists of a resin. On that, the filler particles are dispersed, and this filler particles is attached to the resin with the help of coupling agent. You all know that. So resin matrix, you know, normally we have this GMA, UDMA, Tech DMA, etc. Why Tech DMA is there? Tech DMA is added to control the viscosity or the flow of the composite. Okay, that is a very important point, first of all. Second, coming to filler particles. We know that there are a lot of filler particles. Filler mainly contain the silica. And you have to know that silica is a main component as filler particles. Then comes the barium and also glasses of barium, quartz, zirconium. These are actually the barium and zirconium are responsible for giving the radio opacity. That is also a very important point that you have to keep in mind. Hope you understood. So I have added only not the descriptive part, only the important points that you have to make the flashcards. As I've told earlier, it is very important to take a note and you have to note it point wise so that at the end of the exam you can just actually flash through your notes, right? So talking about filler particles, as I told, they consist of certain radio opacifier agents like the barium and zirconium. You have to know that. Then comes the coupling agent. You all know it is organosilanes and also zirconates and titanates is there. So how do you memorize this? I've just given a mnemonics, that is TOS. You can remember the coupling agent mnemonics as TOS, which consists of titanium, O for the organosilanes, and Z for zirconates or zirconium. So please note this mnemonics, which will be helpful for you to actually answer the questions which is related to this. So you know this coupling agents actually adhere the resin matrix on one side and the filler particles on the other side, and this is how they join together, right? So some of the important points that you have to note. The resin matrix is sometimes called as a continuous phase. So because resin is actually in a continuous phase and the filler particles are dispersed in that. That is why the resin matrix is also called as a continuous phase. In Kerala 2015, a question was actually asked related to that. That is why I have given this important point. Now, filler particles is actually dispersed, so that is called as the dispersion phase. And the third important component is coupling agent, as we have told that organosilanes, and you can memorize by the mnemonics TOS. Right. Next is inhibitors are they. Why inhibitors are required? So we know that normally composite, they when they get exposed to light, polymerization take place or setting of the composite take place. So what happens if prematurely they take place? It cannot be used for like a restoration purpose, right? That is why within the composite there is something called as hydroquinones, which are the inhibitors that prevent the premature polymerization of composite. So that is the use of. So the question has been asked from that, which are the inhibitors in composite that prevent the polymerization or the pre-polymerization? That is hydroquinone. Please keep in keep that in mind. Another important area from which question is being asked is like, which are the opacifiers that is used in composite? Again, I have made a mnemonics. You can remember it as oats or oat. O is actually the opacifier, A is the aluminum oxide, and T is the titanium dioxide. So please keep this mnemonics in your mind. Oat, that is O is the opacifier, A is actually the aluminum oxide, and T is actually the titanium dioxide, which is the opacifiers. So hope you all know this image that, as I told, the resin matrix is a continuous phase. It consists of filler particles in a dispersed phase and the coupling agent with adhere these two particles together. So coming to the first question, the coupling agent between filler particles and resin is. So we have already discussed what is the code for coupling agent. Like I've already told, like last slide I have told coupling agent is TOS, titanium, zirconates and organosilanes are there. So you can see this silane, vinyl silane is actually the answer. Okay. To increase the radio opacity of the composite, which is required. So we have actually, which are the radio opacifiers? Hope you know that mnemonics, right? So it is actually aluminum oxide. Third question, which of the following is added in composite to provide opacity? Again, asked question from 2011. So we have already oats, right? That is the code. Opacifier is like O, A for aluminum, and T for titanium. So the option is C, titanium oxide. Hope you understood these area in this question and important points from that, right? So talking some other important points from filler particles. So we know that what are the properties of filler particles? Filler particles actually increase the strength, hardness and aberration resistance is increased when more the filler particles or the dispersion phase is there, and they actually decreases the polymerization shrinkage. So I'll be discussing about polymerization shrinkage in the subsequent slides, but they decrease. More the filler particles, the shrinkage of the composite will be decreased. Okay. So hope you all know what is polymerization shrinkage, right? When light comes and fall on the composite, there is polymerization reaction taking place. So what happens if the quantity of composite is like this? They actually comes together. That is called as or reduction in the size of the composite. That is called as shrinkage, polymerization shrinkage. That is, of course, it is a disadvantage. Like if polymerization shrinkage happens, it won't adhere to the walls. There will be small spaces that are seen in between the composite and the cavity wall. There will be micro leakage and secondary care is taking place. So we have to take all the measure to reduce polymerization shrinkage. One method is by increasing the amount of filler particles in composite that reduce the polymerization shrinkage. So, what are the filler particles? As we have already discussed, they consist of glass, silica, barium, yttrium, are the popular fillers which actually produce radio opacity. This is very important area you have to know. Frequently asked question from this area. Some other points which we are not much familiar with. What are inserts or mega fillers? So you have to know they are very small glass particles of a size of 0.5 to 2 mm. So they are mainly actually used in posterior composites, especially large amount of force and occlusal wear happens. The composites used in that area, it is actually where we add the mega fillers. So you have to know what is mega fillers or inserts. It is having a size of 0.5 to 2 mm. That is very important. So actually they actually improve the wear resistance. So next two important terms is homogeneous composites and heterogeneous composites. Just read, if the composite contain simple fillers and uncured matrix, simply, there is no cured matrix, there is uncured matrix, that is homogeneous. If there is cured matrix, that is heterogeneous. That is only difference between the homogeneous composites and heterogeneous composites. And another important thing, these values you have to know because question is being asked, which is nano, which is actually microfill. So megafill, you know, as the name suggests, is a very large particle seen. Macrofill is 10 to 100 microns. Midi-fill is 1 to 10. Mini is actually 0.1. It comes under 1. Micro is 0.001 and 0.1, and as it has been mentioned, that is used in the finishing composites because it is very narrow. It will give a proper wear resistance. That is why microfilled has mainly been used in finishing composites. Okay. Nanofill is also called as ultra small fillers, that is 0.0005 to 0.01 microns. So this box again you have to keep in mind because a lot of questions have been asked from these areas. Next important topic is coupling agent. So you know coupling agent is actually a thing that adhere composite on one side, resin on one side and the filler particles on another side. So we know that that is an organosilane. So now see this box. This is the organosilane, that is a coupling agent. The organosilane have two hands, like we have two hands. The organosilane have one hand, that is a covalent link forming to the fillers, and the radicular polymerization area to the organic resin. So because coupling agent form adherence to the resin on one side and the filler particles on the other side. You have to know this is very important. So, like question has been asked, which part among the following of the coupling agent adhere to the filler particles. So you have to know it is the silanol part of the coupling agent that adhere to the filler particles. You can see in this image, and the methacrylate group actually adhere to the resin because it is resin, so some methacrylate group have to be there. So the coupling agent contain silanol group on one part that adhere to the filler particles and the methacrylate group on one part that adhere to the organic resin matrix. Again, make this chart a flashcard. Okay, very important topic. Hope you understood. Coupling agent, it is an organosilane. Organosilane contain two area. One area is called as the silane group, silanol group. The second area is actually the methacrylate group. As the name suggests, methacrylate group go and adhere to the resin matrix. The silanol group go and adhere to the filler particles. And you have to know what type of linking. Covalent link on one area where it adhere to the filler particles and copolymerization reaction to the methacrylate group to the resin. Hope you understood this area. Again, based on the curing, the composite is divided into various types. So first we know self-cure composite. What do you mean by self-cure? With no light is required, nothing is required. When we keep it in the cavity, there is some chemical reaction taking place. It's set as such. Second is light cure resin. We know we will be giving light from outside. In the presence of light, there is some initiator activation taking place in the composite set. And based on the light, they are of various types. One is visible light, second a UV light is used. Understood? And something called as dual cure composite that sets both in the presence of light and it can sets by own chemical reaction. Hope you understood. Next is stage curing composite. I'll explain later. That is one of the method to reduce polymerization shrinkage. As I have told earlier, polymerization shrinkage is one of the main problem. And one method we have already studied to increase the filler particles. One. Second method is something, there's change in the curing pattern called as the stage curing that I will explain in the further slides. So talking about the first one, chemically activated resin. As I told, there is no light required here. It's set as such. So there is two paste. You can see I have made a mnemonic. You memorize it as A, B and C. See, there is A, B and C. So what does A, B and C? C is the chemically, you memorize it. The last one is chemically activated resin. A is the amine. B is the benzyl peroxide. That is how I used to memorize. So whenever I hear like chemically activated resin, to my mind A, B, C comes. C is actually the chemically activated resin, which consists of two paste. Paste A is actually amine. Paste B is actually the benzyl peroxide. So you can see here, paste A consists of benzyl peroxide, that is one initiator. And the paste B, which consists of an amine, that is a tertiary amine. You have to know the name of that, NN dimethyl P-toluene. Hope you understood this area, right? Please memorize it by using the mnemonics A, B, and C. So, hope you understood, right? B is for benzyl peroxide. A is for, it's an amine. What tertiary amine? What is the tertiary amine name? NN dimethyl P-toluene. Hope you understood. So, what happens when this two paste is being mixed? So, the initiator get activated, free radicals are produced, and there initiates the polymerization reaction. Hope you understood. There is no light required in chemically activated resin. Hope you understood this chart. Again, make a flashcard. Again, try to memorize this mnemonics. Okay. Next important MCQ question. This composite is manipulated by mixing the proper proportion on a mixing pad with a negate spatula, but never with a metal spatula. Why? The metal spatula often discolors the composite. So that is a reason why we always use an agate spatula. Please keep this important point in your mind. So coming to the light cure which we use in our day-to-day life, that is the light cured composites. And one of that is actually the visible light composites. You know, visible light composites. So there it consists of again an initiator and activator like what we have studied in chemical cured. The initiator is camphoroquinone. Please keep that in mind, camphoroquinone. The activator is again an amine. You have to keep this name also, or diketone. Sometimes a question answer might contain diketone. So never get confused. Activator is AA. Activator is an amine, that is diketone, also called as diethylamino ethyl methacrylate. So this is a very important area. So hope you understood. Visible light again consists of an initiator and activator. Initiator is camphoroquinone. Since light is there, you think like camphor. Camphor is light, right? Think like that, camphoroquinone. And activator is AA, amine. And you have to memorize, it is also called as it is also like diketone. That term has to be kept in mind. So we know that the most popular composite which we use is actually the visible light cure composite, not the chemical cure composite. And what is the light wavelength of light we have to use? That is very important. It is 400 to 500 nanometer of light that is commonly used, and predominantly it is 474 nanometers. So please keep this important point again in your mind. 400 to 500 nanometer. In that 474 nanometer light is actually predominantly used for curing of composite. Another important, again, I told camphoroquinone is actually the initiator. So camphoroquinone absorb photons. When we actually put light, the camphoroquinone get activated and there starts the reaction. As I told, which is the activator? AA. Amine is an activator. Amine is also called as diketone. That is why they are called as diketone is the activator. Sometimes in question, the question might be in light cured composite, which is the activator. Sometimes the option might be diketone. Sometimes the option might be like an amine. So you have to know these two terms. Hope you understood. So if we use a darker shade composite, more time is required for the curing. Okay. And light curing can be also done with halogen curing lights, LED lights also been actually used. Okay. Now, some other important point is like health hazard is actually usually eliminated when we use a visible light cure. When, as I told earlier, we use UV light, right? UV light, as the name suggests, UV have lot of health hazard. But the visible light, as you know, it is visible. So it is actually the health hazards is very less compared to the other. So no warm-up time is required. That is important. Minimum 20 seconds for adequate curing. That is advantage. See, the amount of light which we have to give in the light curing which we do is just 20 seconds. But in the case of UV light, the disadvantage is like more of time is required. So that is a time-consuming procedure for us, right? So this is a main difference between a light cure composite and a UV cure composite. In light cure composite take about 20 seconds only. But in the case of UV light, it takes about 60 seconds. Okay. And what is the distance at which the tip of the curing light should be placed? It is actually 2 mm. So the tip should be actually placed at a distance of 2 mm from the composite. Okay. It can cure a depth of 2 mm. And if larger area is cured, it is carried out in increment. So always we have to place small increment of composite. So question might be asked, how much increment of composite is actually placed? It is 2 mm of composite we place it cure. That is because the light can penetrate very well in a 2 mm composite. That is why 2 mm of composite is always used in increment cure, place 2 mm cure, 2 mm cure. That is how we cure composites. Hope you understood this much. So some important differences that you have to keep in mind. We'll start from down. As we have studied, UV light is not used now. Visible light is which we use. As I've told earlier, what is a range? Try to memorize. It is mainly 4. Yeah, we have already told here. It is 474 nm that is actually used. But UV light comes under 360 to 400 nanometer. One difference we already studied. What? What is the time? 20 seconds for the visible light, 60 seconds for UV light. That is more time consuming. And we told there is no health hazard with the visible light. But the UV light is having, see, it is very much injurious to the retinal damage, eye, retinal damages. So the question again has been asked from that area, which part of the eye is affected, like the optic nerve, retinal area. So the answer is retinal damage is more commonly seen when we use UV light. See, the depth of cure means it can cure only 1.5 composite, but in the case of visible light it can more of a composite can be cured, so the time consumption is less in the visible light. So of course visible light is good when compared to that of the UV light. Hope you understood why we are actually using visible light when compared to UV light. UV light is very much hazardous, it contain retinal damage, it cure only 1.5, it need more time of 60 seconds, here only 20 seconds. 2 it can cure, no health hazard. Hope you understood. Next important difference about chemical cured composite and light cured. We already studied chemical cured. We have studied the chemistry part. It contain the initiator and activator system, etc. We have studied. So chemically cured, the polymerization is central. But in the case of light cure, the polymerization is peripheral. Here you can memorize like CC. Chemically cure, it is central, CC. Okay, curing is in one phase, because we will be actually mixing and we will be placing within the cavity. So it is in one phase. But light cure, we know, we place small increment, then we actually cure. This system sets within 45 seconds. But here, once we actually give the light, it sets faster. That is a difference. So working time is limited in chemical cure, right? We are mixing and we are keeping, right? There is no manipulation we can do. But in the case of light cure, once we place composite, we can carve, we can actually do all things, then only cure, right? At that time only, it will set. But here the wastage is more. Like light cure, we can keep how much we want. Their mixing is taking place, so we don't know how much the composite is being taken. So there is actually wastage taking place in what this chemical cure composite. Again, what is the advantage of light cure over self cure? Self cure means chemical. What is the advantage of the composite which we use? Good working time is there. Porosity is very less. Better wear and abrasive resistance. All are good when compared to the self cure or chemical cure. One of the question, of the light produced by quartz tungsten halogen, only a small percentage is suitable for curing composite resin and most is converted into heat. See, the answer itself is giving. Why we are not using nowadays quartz, tungsten, halogen lights. We are only using visible lights. See, large amount of heat is produced. You know, when heat has been produced, it may damage our pulp. It may have deleterious effect on the pulp, etc. Right? Because the dentine is very much near to the pulp. So that is why this kind of light is not used. They are asking how much percentage of this light is. Only 0.5 percentage of light is coming for curing. The rest 95% is converted into heat, very harmful for the tooth. To minimize any heating that might occur during the light curing, some filters are normally used that you have to know. There are two filters commonly used, that is a UV and infrared band pass filter. So what they do is like they actually limit the unnecessary heat production and limit the unnecessary light production. Hope you understood. As I told, dual cured composite are those which can set in the presence of visible light and there is chemical curing or self-curing taking place. So they are normally recommended for ceramic inlays. Okay. Next, you have to know some terms like macro ceramics, micro ceramics, and colloids. So macro ceramics, there are various generations of composite. See, there are various generations of composite. So macro ceramics come under the first generation composite and they contain the particle diameter between 5 to 75 micrometer. That is why it is called as macro. But the micro come under the second generation, which consists of the filler particles like silica, colloidal silica, which is not having a size more than 0.04 micrometer. Here it is 75 micrometer macro. Hope you understood the difference. Okay. Now, talking about the 6 generations of composite. First generation is like, as I told earlier, they consist of macro ceramics. So more the bigger the structure, it will have surface roughness, it is not having good properties, etc. Second generation, there came the micro ceramics. As I told, that is 0.04 micrometer. So it have a very good texture of the composite. It had good properties like the strength, coefficient of thermal expansion, etc. Right. Third generation, they actually used hybrid composite which contain both macro and micro ceramics in the ratio of 75 to 25. So you know both the properties came. It would be good when compared to the first generation and the second generation. Then come the fourth generation. So they are also a hybrid type, but instead of macro ceramics which we use, they contain heat cut irregular shaped ceramics is being used. So they have a very superior restoration and technique sensitive. Hope you understood. First was macro ceramic. Second was micro ceramic. Third was macro and micro in the ratio of 75 to 25. Fourth, we eliminated macro. Macro is not good. And there come heat cured irregular shaped ceramics we used. Fifth generation, again it is hybrid type, and what we do is like the resin phase is reinforced with micro and macro heat spherical. Early it was spherical, irregular, right? Here macro ceramics with spherical shape was actually used. So it gave actually more good property when compared to fourth generation. Then the sixth generation, it is again a hybrid composite which consists of microcolloidal ceramic. It was agglomerated and sintered, so there was more adherence and which gave good properties, mechanical and physical property. This is again a very important topic. So first generation macro ceramic, second generation micro ceramic, third generation macro and micro in the ratio of 75 to 25. Fourth generation, we removed the macro and we used heat cured irregular shaped ceramics. Fifth generation, we used the macro with spherical. There was irregular, here spherical. And sixth used agglomerated ceramics. Now, some important composite property that you have to know. First is degree of conversion. So what does degree of conversion means? So when we know polymerization take place, there is double bond converted to single bond. So the measure of percentage of how much carbon-carbon double bond get converted into carbon-carbon single bond. That's it. Double bond to single bond. So higher the degree of conversion means what? Good property. Because that much polymerization is taking place. So that much good properties are there. So please keep this in mind. That's it. What is degree of conversion? Polymerization of conversion of carbon-carbon double bond to carbon-carbon single bond. One. More the degree of conversion, more polymerization have taken place. So the properties, physical and mechanical properties will be good. Now, C factor, very important. What is C factor? You have to know the full form. It is configuration factor, which was explained by Felser et al. What that means? It is bonded surface to unbonded surface. When we place composite, right, which all surface to which the composite go and adhere and to which it doesn't adhere, that is C factor. That is C factor, always also called as configuration factor, that is bonded to the unbonded surface. As I told, what I have told in earlier case, degree of conversion more, it is good. But here, the higher the C factor, the higher the stress level. That is, you have to know. I mean, higher the C factor means what? Bonded surface more. So more the stress, more polymerization shrinkage taking place. Okay. See, the higher the C factor, so C is equal to bonded by unbonding more the bonded surface, greater the, so more the bonded surface means what? Bond disruption also, the tendency is more the poly, all is directly proportional. C factor directly proportional to the bonded surface, directly proportional to the polymerization shrinkage, directly proportional to the stress development. Not good. Okay, see, in class 1, so what is the bonded surface? 5 surfaces are bonded by the unbonded surface is 1. So the high risk of polymerization shrinkage is seen in class 1. Low risk is seen in class 4. So that is the difference between class 1, class 2, class 3 and also class 4 type of like the restorative surface. Now, as I told, polymerization shrinkage the shrinkage take place in such a way that the restorative material is pulled away from the cavity. As I told, as the cavity get actually pulled away, there is space seen in between the restorative material and the cavity wall. So there is a chance of large amount of micro leakage, intern cavity, caries, etc. taking place. So it is always important to reduce polymerization shrinkage. We have already studied earlier, polymerization shrinkage is reduced by adding filler particles, one. And I have added some to know, this is just to know. First, I told you have to add what? Filler particles. Second, there's placement method that you know, right? Placement method, there's incremental technique. Early, we used to keep the bulk. It is not good. Now we use increment technique, like layering techniques. We keep horizontal layering technique, vertical layering technique, oblique layering technique, all those reduce the polymerization shrinkage. There is something called a silurines. So normally we know this GMA, etc. See the pattern of silurine, it does have cycle-like pattern. So the polymerization take place by ring opening mechanism. So the polymerization shrinkage is less. So these are the methods how to reduce polymerization shrinkage. One is filler particles adding, second is adding silurines because ring polymerization take place. So the polymerization shrinkage is less. Third is what? As I told, the incremental technique. More the type of incremental technique, less will be the polymerization shrinkage. Always cure in 2 mm increment. That is very important. 2 mm the increment, the polymerization shrinkage will be less. So alternative method, as I told, normally what we do, we keep the light cure, we cure it for like 15 to 20 seconds. There is something called a soft start curing. See, soft start curing, as the name suggests, we start with lower intensity of 400 watt and when we increase to 800 watt. So what happens is the amount of polymerization shrinkage is less. So that is one method. Sometimes the question might be, among which the following is a method to reduce the polymerization shrinkage. So if you see a soft start or ramped light curing technique, you have to answer that. Ramped curing, again, that it start with 300 watt and they move to 800 watt. Pulse delay technique, again, the watt is actually reduced. I want you to know these names. That is important. Next is trans enamel polymerization. So when we place composite, we cure through the composite. So instead of curing through the composite, what we have to do is like, we have to cure through the enamel. That is trans enamel. So it moves through the enamel, then goes to the composite part. So that is also one method to actually reduce the polymerization shrinkage. So I just want to give a very brief knowledge on the cavity preparation because that will be dealt in conservative. So being an intern, it is very important to know because most of the people don't know what is the preparation of composite. There are three important preparation. One is the conventional method which we use. Conventional method is like the amalgam preparation. Please keep that in mind. We give the amalgam preparation. Bevel convention means what? We will be giving the amalgam preparation, but we will giving a bevel so that the composite merges with the cavity properly. Next is the modified method. Modified method is which we follow. Minimal preparation, where KRS is there, just give a saucer-shaped cavity. We will be filling composite because it is having a micromechanical bonding with the tooth surface. Hope you understood. Important point for your need. Cavity preparation for composite is beveled. We will be giving bevel except where? Except when the margin are in cement. If the margins are in cementum, we should not bevel. Okay? So conventional preparation, as I told, it is similar to that of the amalgam preparation. It is having a box-like cavity, 90-degree butt joint. So simple. Beveled, as I told, we'll be giving a bevel all around. And modified preparation, where the depth is not important. We'll be giving just the cavity area, which has to be, the caries has to be removed and fill the composite. Hope you understood the like basics of the composite, especially the material part. As I told, you have to know what are the various phases, various composition of the composite. You have to know the generations of composite and various mnemonics I have already given. Please go through that. So next, coming to the very important another topic, that is enamel adhesion, dentine adhesion. I want you to listen to this area very carefully. Okay. So we know enamel adhesion in the year of 1955, Bunocore, what he did was like he used diluted phosphoric acid to etch. A lot of acids were used, but phosphoric acid showed good of a etching of the tooth surface. It showed some irregularity on the tooth because the acid removed the enamel, and they produced some micromechanical, microscopic enamel roughening, and there was tag formation of the composite to that of the tooth surface. Very important. And what depth? That is 10 to 40 micrometer depth was actually seen where the composite go into the enamel, and the enamel produced this much depth of tags. So very important, Silverstone was a person who gave this microscopic changes. When we actually put acid on the surface of tooth, there is some changes that is taking place on the tooth surface. That is type 1, type 2, type 3. So we know that there is a rod seen, right? It consists of a core and it have a periphery. So when the core goes and the periphery sits as such, that is type 1. When the periphery is dissolved and the core is left intact, that is type 2. And the type 3 is less distinct than the 2 pattern. Hope you understood. Type 1, the dissolution of the core, the periphery as such. Periphery enamel is dissoluted in the second and core sit as such. Third, all goes. Okay. Now, why we know, you all know the percentage of phosphoric acid is 37 percentage. Why 37 percentage? Why we are not going into other percentages of phosphoric acid? See, if the phosphoric acid percentage is more than 40 percentage, what happened? There is a salt formation taking place on the surface of tooth, that is mono calcium phosphate monohydrate. Think more percentage means all mono. So it is more 40 percentage mono calcium phosphate monohydrate. Less than 27 percentage means dicalcium phosphate dihydrate is formed. So these salts are responsible for what the surface become irregular because of the salts. That is why we use 37 percentage of phosphoric acid. This is very important. This percentage is important, and they'll be asking what kind of salt is being produced. Please keep this point in mind. As I told, there is micro tags and macro tags formed on the tooth surface. Micro tags and macro tags are required for the mechanical bonding to take place. Most micro tags, what is the depth of micro tags? They are normally 2 to 5 mm in length. More than 5 mm means it will be macro tags. Please keep this in mind. Currently, the length of etching will be for 15 seconds. That is the most acceptable time. But in two cases, this is very important, in fluoridated tooth and in the case of primary teeth, the time for etching is more. Why? What is the dentine and enamel made up of crystal, hydroxyapatite crystal, that is Ca10, PO4, 6OH twice. But in the case of fluoridated tooth, it consists of fluoride, which is more stronger and more like acid is required for its demineralization. Right. That is why fluoridated teeth require not 15 seconds, more time is required. Why primary teeth require more time? Because it consists of large amount of prismatic enamel. A prismatic enamel, that is why. Okay, so the etched area is rinsed with water for 20 seconds. After once we rinse, we'll be etching that area and it is rinsed with water for 20 seconds. So what happened? Next important question. After etching, how much surface area is actually increased? About 2000 times the surface area is increased when compared to that of unetched area. So this is very important topics, points that you have to make flashcards. Next, even other acids like malic acid, citric acid, oxalic acid are also used for etching the enamel and dentin. But what is the problem with these acids? They are not stronger as that of phosphoric acid. They are called as conditioners. They are called as mild acids. We used to use conditioner in our hair, right? Is it very harsh? No, it is very mild. So these are called as the conditioners. So what happens? So we know when we do composite, sometimes the saliva comes and actually contaminate the etched area, right? So what we have to do? Again, applies the acid for just 10 seconds. Understood. So the enamel bonding agent is applied to the etched area, and it will actually increase the wettability. Hope you understood that much important point. As I told, what is the percentage? Why not more than 40? Why not less than 27? Micro tags, macro tags, fluoridated tooth and primary tooth, it will be more. Okay, hope you understood. Next, very important topic, uh, bonding agent. dentine bonding system. So, people started thinking about dentine bonding agent separately. Why? Do you think the composition of enamel and dentine is same? No. Yeah, right. The organic content and the water content in like dentine is more. We know there is dentinal fluid flowing in the dentine. So what happens is like there is if we a river is flowing, if we place something in the river, will it stay there? No, it will get flushed out. Similarly is the case of dentine. It is very much hydrophilic in nature. It's water loving. There is a lot of water present in the dentine. So we need some bonding agent so that it is having both the property which are hydrophilic and hydrophobic. Why? Please take this into mind. This is very important. So I'll discuss this first. Why dentin bonding is difficult? First, I told that pulp is very much near to the dentin. One. So we can have to use acid in such a manner it does not have any deleterious effect on pulp. One. Two, dentin consists of large amount of water. Three, it consists of large amount of smear layer. When we cut, smear layer is formed. So these are some of the difficulties we face when we place dentine bonding agent. So, very important topic. What is dentine bonding agent? Dentine bonding agent contain two important part. A high, see, like my hand, a hydrophilic part on one side, a hydrophobic part on another side. Why? Because dentine bonding agent should adhere to the tooth. So you know, tooth is what water loving. That is hydrophilic. What is composite? Do they love water? No, they are hydrophobic. So dentine bonding agent is a multiple personality person who should have both the characters to hold these two together. Understood? So dentine bonding agent, as you can see, it should adhere to the dentine, that is hydrophilic. It should adhere to the composite, that is hydrophobic. Hope you understood this much. This is the structure of dentine bonding agent, MRX. So it contains, this is the methacrylate group that adhere to composite, which is what? It is hydrophobic composite, where X is actually a functional group that adhere to the dentine, that should be hydrophilic. So this is actually a spacer, normally a carbon chain. So carbon chain, one hand contain methacrylate group that adhere to actually the composite resin, which is actually hydrophilic, hydrophobic composite. The other functional group go and adhere to the dentine surface, that is hydrophobic. Hope you understood this. So as I told earlier, there is something called as a conditioner. Conditioner is actually mild acids like the malic acid, citric acid, 10% phosphoric acid, DDTA, etc. Mainly why we use a conditioner, we will be using to actually remove our dandruffs, our waste products like that, right? Similarly, conditioner is also used for removing the smear layer. That is very important. Just remove it. It is a weak organic acid. Now what is again primer? What is primer? Primer, as I told earlier, the dentine bonding agent should have two property to adhere to both the composite on one side and dentine to another side, who is having two different character. So primer is actually that person. It is actually the bifunctional person who have what? Hydrophobic part on one hand, hydrophilic part on another hand. Hope you understood. Example is 2 hema, right? So talking about the various generations, first generation, as you all know, it was in 1950s. What was the problem? Just the important thing, it didn't adhere to the dentine. Instead, they go and adhere to the calcium in the smear layer. So there was just chelation. There was no proper adherence. So what happened is like there is no proper bond strength took place. That is the first generation. Then came to second generation. Second generation, what happens is like there was a polar interaction, ionic bond between the phosphate group in the resin to the smear layer again. So there was no proper bond strength. That is why we eliminated the second generation. We went to third generation. There come the three-step method. First, we'll be actually using, here everything was separate. Enamel was etched separate, dentine was etched separate, then we used a primer. Primer what? That is the bifunctional substance, then the adhesive, that is a bonding agent. So three step. First is what? Conditioning or the etching. Second is the primer adding, then the bonding. Now we have only, see, bonding a single bottle. Early, there was another bottle called as the primer. So think this is a denti. We'll be applying the etchant or the conditioning agent. Enamel separate, dentin separate. Hope you understood. Once we wash out, then we apply the primer. We wait. Then we apply the bonding agent. Then we wait. Then we apply the compost. That is why it is called as 3-step. First is the etching. Second is the primer. Third is the bonding. Understood? But it had good bond strength compared to second and third. But it is very time consuming. Don't you think it is having a lot of step? There where we came to the fourth generation, there everything was like called as a total etch technique. There what we did, enamel was etched separately, dentin was etched separately, primer, bonding agent, then the composite. Here enamel and dentin was etched singly for 15 seconds. So that step decreased. Then we actually, what we did, we used the primer adhesive. Here, something was wet without drying the surface because that concept was used. Wet bonding concept came here. And hybrid layer. We know hybrid layer was actually developed by Nakabayashi. He told that what happened when we put acid on the surface, there is exposed to collagen materials, collagen fibers. The composite go and intermingle in between the collagen material, forming the hybrid layer. So fifth generation have two bottle system. One is the H, second is the PA. EPA, you can memorize like EPA. H first, PA, primer and adhesive together. Sixth generation, see, HN and primer together. Second is the adhesive. So these are the difference, main difference. Seventh generation, all came in one bottle. Hope you understood. Well, first one is chelating, only chelating. Second one, there is polar interaction. Third generation, there were more steps like enamel etching, dentin etching, priming, bonding agent, adhesive. Fourth generation came, enamel and dentin etching bond together. That is total etch technique. Okay, fifth and sixth bottle, seventh is all in one. And some important terms that you have to keep in here in mind is acid etching was AB. You can memorize like AB. Acid etching was by actually Bunocore. Hybrid layer was by the Nakabayashi and BIS GMA by BB Bhavan. Dentin bonding agent usually contain. Now you know it have to have two important property, hydrophilic and hydrophobic. What is appropriate stress caused by polymerization shrinkage? Whenever shrinkage take place, there is 15 MPa of stress that is seen on the tooth. So stress development, crack formation, etc. take place. What is the concentration of etchant if it is more than 50%? What we have already studied, if it is more means mono calcium phosphate monohydrate is there. If it is less, that is calcium phosphate monohydrate is formed. Soft start polymerization is seen in, it is used with quartz tungsten halogen light curing. So with this we have already studied, like it starts with 400 watt and it moves into 800 watt. What is the purpose of etching? It is of course to actually produce a surface irregularity. If multiple options were there, you can even answer. So this is some of the confusing question. If this is asked as such, you have to answer to produce irregularity. If A and some options are there, these two are the answer. It removes the smear layer also. While working with dental material, the factor C is associated with. I have told earlier, C means configuration factor. More the configuration factor, more will be the polymerization shrinkage. And you have to know this is another important NEET MDS question, bond strength. Amalgam bonding agent provides a strength of 2 to 6 megapascal. Enamel bonding agent produce 18 to 22. Dentin bonding agent produce 25 to 35, which is actually highest. Please keep that in mind. And amalgam produce the least. So we had a very good discussion on composite. Hope you had a good knowledge into composite. So most of the people know amalgam. I have just added the important concepts and only the important NEET MDS discussion questions. So going into amalgam, this is actually an alloy which consists of, you can memorize like this. It is copper, silver, cast. I have made this code cast. Copper, A is not there. Copper, S for silver, T for tin. CST or CAST cast, copper, silver, tin, and contain mercury, zinc, palladium, etc. So, Louis Regnard is the father of amalgam. You all know that. It is also called as Bell's putty because since it was introduced in England, it is called as Bell's putty. So, please keep these points in your flashcard. AD specification 1 is for amalgam, 6 is for mercury, of course. So amalgam means what? It is actually alloy of two or more metals since it contains what? Cast, copper, S, silver, tin, and along with that it contains mercury. So you know, based on actually the alloy binary, tertiary, quaternary is there, you have to know the second classification. Copper more than 6 percentage is actually high copper. Zinc is, if it contain more than 0.01 percentage, it is zinc containing. And powder sized, based on the powder size also, it is micro cut, fine cut, and coarse cut. The question is like, copper content in low copper amalgam is how much? So it is actually 6 percentage, less than 6 percentage is low copper. So function of some of this is very important area. Please never skip this area. Silver, silver is having white color, thing like that. So it actually whiten the alloy. Silver, we use like anklets and all. The silver should be have a good strength. It reduces the creep, right? Tin is actually decrease the tarnish resistance. Resistance has been reduced by tin. Okay. Zinc is actually, which is called as a scavenger. Zinc is actually called as the scavenger or deoxidizing agent. Palladium, you can remember it is again whitening agent like silver. Okay. In amalgam, which of the following is an oxygen scavenger? It is zinc. Zinc oxide, they actually scavenger or take away the oxides. So again, as I told you, you need to know some concept, right? This is a very important concept. See, as I told, you can memorize it as CAST, cast, right? So in early times, the amalgam was called as a low copper amalgam. It doesn't have any copper. So it is having only S and T, silver and tin. So see this image. You know that is gamma phase. Gamma phase is S and T. That is silver and tin. Ag3SN. You can see here it is Ag3SN. So memorize. I have added this code. There is only S and T, silver and tin. So it forms gamma 1. That is the silver plus mercury. T plus mercury, gamma 2. So in the early times, gamma 1 and gamma 2 was actually formed. So gamma is the parent phase is always the strongest phase. That is S and T. Okay, hope you understood. Gamma 1 is the BCC phase. Gamma 2 is hexagonal phase. That is the least stable phase. So this question is very important. Hardness, which is good? Gamma is good. Then comes gamma 1. Then comes gamma 2. All these things as it move further, gamma 2 is the worst phase, is the not the strongest phase, and it is having a hexagonal shape. Corrosion resistance is poor. Hope you understood. So, you know, in conventional amalgam, low copper amalgam was used. The copper was less. Only silver and tin was there. So, gamma 2, what we need to actually reduce the gamma 2, right? So, in order to actually reduce the gamma 2, what we done is like we came to high copper amalgam. See here, first reaction is same. Gamma form gamma 1 and gamma 2. So what we introduced? We introduced the copper. So what happened? This gamma 2 went and react with copper to form the eta phase. So what got eliminated? The gamma 2 got eliminated. So the high copper amalgam had good strength because they eliminated the gamma 2. Hope you understood. In conventional amalgam, there was gamma 2. To eliminate gamma 2, we to the first reaction, see gamma react to form gamma 1 and gamma 2. We added copper. So this gamma 2 went and reacted with copper, eliminated the gamma to form eta phase. Superb, right? Eta is copper is actually the savior. Next, which of the following phase of dental amalgam have minimum strength? You know, it is gamma 2 phase, minimum strength, which is not true for a high copper amalgam. High copper is good, we know. So low tensile and low compressive strength. No, of course it have good compressive and good tensile strength. So some important again flash notes that you have to add. AD specification according to number 1 amalgam. The dimensional change, we know that there is some dimensional change taking place in amalgam. It should not be more than 20 micrometer per centimeter. That is very important. Creep should not be more than 3%. These are values asked multiple times. Please keep that in mind. The creep is a process can cause an amalgam restoration to extend out of the cavity and it causes marginal breakdown. Okay. And it is most commonly seen in low copper alloy because as I told, there is gamma 2, which is not good. Okay. And you can see the box. This is very important again. Creep is too much for a low copper, like 8%. Single composition, it is like 0.1%. Admix for 0.4%. I've added this again. This is a very important portion. You have to make a flash note on this. Now, what is micro leakage? You can see in this image itself. The composite, there is dimensional change, there is micro leakage taking place, and there is because of a gap of 2 to 20 micrometer. That is what it produces. And what happens, what is self-sealing property of amalgam? As I told, amalgam might have, because it is not having chemical adhesion with tooth surface, it is produce space in between. But what happens is like, as age increases, they form corrosion products and the space get filled with this corrosion product. That is why amalgam, it self-heals. Understood. The problem that is micro leakage is being self-healed by the production of corrosion products. Hope you understood. Now, one of the main important problem with the amalgam is corrosion and tarnish. So again, important Viva question. Low copper amalgam, you know, which is the bad phase, gamma 2 phase. So gamma 2, that is a tin I told, tin is the problematic person. Tin form tin oxychloride. So these are the corrosion product. That's what you have to keep in mind. Low copper produce tin oxide, tin oxychloride. And this tin oxide and tin oxychloride, which responsible for gamma 1, gamma 2 is responsible for the macroscopic or primary expansion. Okay, so sometimes the question might be, what is the primary expansion? That is because of gamma 2 phase primary expansion take place. Now, high copper amalgam, no gamma 2 phase is there, right? But eta phase is the least corrosion resistant. But still there are some corrosion product like CuO. Please keep that. Sometimes CuO is produced. So hope you understood this. Now, as I told, that was the primary corrosion product or macroscopic expansion. So you know something called a secondary expansion, right? So what happens in zinc containing mercury, water get incorporated and hydrogen gas is produced. So they increase in size. It take place in 3 to 5 days and the value is more than 400 micrometer. Okay. Trituration is a process of mixing the mercury to that of amalgam. And there are two important processes called as Ames ratio. You know, it is 1:1 ratio. But the other names are important. Minimal mercury technique or no squeeze cloth technique. That is very important term. And another technique is like increased dryness technique or squeeze cloth technique. And you know, the hand mixing which we do is for 24 to 25 to 45 seconds. Mechanical mixing, there are 3 speeds. Amalgamators are the machine which we use to mix mercury, right? There are 3 types, low, medium, high. You have to know the speed also. There is something called as coherence time. That is a minimum mixing time required for the amalgam to form a single pellet. Understood. The minimum time is 5 TC, 5 coherent time. You have to keep that in mind. Setting time of amalgam is best controlled by. It is actually the trituration time that actually determine the setting time of amalgam. So you have to know both the setting time and the trituration and the speed is actually responsible for the determining the working and the setting time of amalgam. So as I told, Ames technique is actually also called as minimal mercury technique, which use 1:1 ratio of mercury and alloy. Pulling is like, it is the continuation of trituration where we will actually remove the excess of the amalgam. It is normally done in a rubber dam or glove with for 2 to 5 seconds. That is important. Then comes the mechanical molding. So mechanical molding is done for 2 to 3 seconds. That is important. As I told, hand molding is for 2 to 5 seconds. Mechanical molding is for 2 to 3 seconds. Next, we apply the amalgam into the cavity. So what is the pressure? This is another important question. The force is the recommended force is 66.7 Newton of 15 lbs. Okay, but the average force is like 3 to 4 lbs. This is again very important point. So some of the side effects of mercury is like allergy as well as toxicity. Allergic reaction is mainly the antigen antibody reaction like itching, rashes, sneezing, difficulty in breathing, etc. This is another important question. What type of hypersensitivity? It's Coombs type 4 hypersensitivity reaction or contact dermatitis that is seen with mercury. Some concentration of mercury is important, especially what is the maximum allowable level of mercury in blood is 3 microgram per liter. Okay, and again, this is another important chart that you have to trituration. The maximum amount is 1 to 2. For condensation, it is 6. Dry polishing 45. Wet polishing is 2 to 4. Okay. Again, as I told, these are the toxic reactions. So, low level like 3 to 7, it's okay. But when it reaches 500, it leads to paresthesia, 1000 ataxia, 2000 joint pain, and 4000 it causes the hearing problems. So, absorption of mercury in the human body occurs least from, it is from kidney. There is less absorption. The threshold limit value of mercury exposure is, it is 0.05 mg per m3. So that the threshold limit is minimum less than that. Mercury intoxication in dental office mainly result from inhalation of the mercury vapors. So all the waste amalgam is always stored in a water that contain the photographic fixture, that is a sodium thiosulfate. Please keep that in mind, or the water or the glycerin. These are the options. So some of the advancement in amalgam, gallium-based amalgam is there. What is indalloy? It contains indium. Fluoride containing amalgam is there. Low copper amalgam. Bonded amalgam again, it contains 4 meta. Very important. What is the amount of fluoride? As I told, there is fluoridated amalgam. It contains what? 1% of strontium fluoride is actually only 1%. Okay. What is the average mercury content in a well-condensed amalgam? It should be 50%. Please keep that in mind. 50% is the average mercury content after we do a well-condensed amalgam. So these were the very important topics from amalgam and composite. Thank you for hearing. Thank you for listening. Please go through the video again. And if you have any doubts, please come to me and please clarify all the doubts. I want you to actually read the synopsis part because I've covered most of the synopsis part. It's better to hear the video again and go through the synopsis part, read. As I told, read 100 to 200 questions daily. And it is very easy to crack NEET MDS if you are consistent. We might not be there to like each day to run behind you. Actually, it is your self mind and your what determination to get all these things. So work hard. We are always there with you. Thank you. Good night.